Hi there, welcome to Trades Talk on Lesbian Visibility Week. We have here a local doctor from the NHS and who works for the University of Leicester called Zoe, and she's kindly given us her time to talk about being a visible lesbian in Leicester. And this is really important to us because it's something that queer women and lesbian and bi women experience all the time, that they're not necessarily feeling comfortable and able to be visible in the community due to, fear of negative feedback, basically. And this is shown in multiple amounts of research from, the LGBT consortium and in lots of different cities. So it's really great that we've got her here to talk with us today. And we're also going to touch upon sexual health because Trade is a sexual health charity. So, um, Zoe, we've got a few questions for you. We're going to talk a bit about being a visible lesbian in Leicester. So, could you tell me a bit about what made you feel comfortable or want to be a visible lesbian?
Yeah, sure. So I think I'm in quite a lucky position because I've got a huge amount of support around me. My family's always been really supportive of me, and I am in a stable relationship. I'm married. My wife's family is also really supportive. We've got a great group of friends around us. So I think it's that and that privilege that came with that meant that it was actually a relatively easy decision for me to be out and proud and happy to be seen. Particularly, I think once I found that stability, it felt almost easier to be out and visible, and like the right option for me. I think it's also important as a deliberate decision to try and be sort of visible when it's possible. So for someone like me, where it is possible and it's relatively easy, I almost felt like a responsibility to do that, so that other people had someone that they knew was at least an ally, was a safe kind of place to come and chat if they wanted to, and that they could see that other queer women were sort of out living their lives and having a nice time.
Amazing. It's so exciting and positive to see, a bi, lesbian, or queer woman just living their best life and really happy and stable. It's not something you see all the time. So I feel really privileged that we've got someone here to say that it can be done and to
Yeah,
prove it to
absolutely.
us.
It's the best. I love it.
Exactly. Amazing. And speaking of which, you were saying it's really important to be visible and represented. And so that kind of ties in with what we were talking about just before we started recording this about you being on the committee at your workplace, the LGBT plus committee. And obviously that's quite a bit of responsibility, but also it's really exciting to be able to meet other people. What kind of things made you want to get involved in that?
Yeah, so I guess my decision to get involved was kind of two-pronged. Partly it was selfish. I just moved to Leicester as a new city. I wanted to get to know some other people, preferably from an LGBT plus community. I didn't have many other LGBT plus friends here, so I thought that might be a good way to do that and to meet people who were like-minded at my workplace. But also I thought, particularly working at a university, it was quite important to have people, LGBT plus people, at all different levels of the university who were kind of out and proud and visible, both so that any staff sort of knew that it was a safe place to work, but also so that students felt comfortable, and so that the university seemed like an inclusive and welcoming space.
That's really admirable, to be honest. You said it was selfish, but it's doing an amazing thing. It's giving back. It's representing your, your community in front of all the students and the staff. I think it shouldn't be, overlooked how significant that is. So I think it's a
Thanks,
great
but
thing to do.
it is partly selfish too. It's quite fun.
Well, I hope you found some great LGBT people then when you did join. That's great. Okay, so our next question is, what was your most surprising experience of coming out and being queer and visibly queer? And I use that term in a really endearing and positive manner here.
I think probably the most surprising overall is actually that it, for me, again, obviously my experience is quite specific and I don't want to speak for other people, but I think partly what's been surprising is actually it's been pretty easy. I've had a pretty easy run of it. My work, it's not a major issue at my workplace. Mostly I can just get on with my job and it's not a major thing. People ask about my wife and want to know how my life's going. And mostly it's just pretty normal. So I'm really, really lucky from that point of view. I guess if there's been one challenge or one thing that's been a little bit surprising is I think I'm pregnant at the moment, and I think people, thank you. And I think that caught a few people off guard. Maybe they wouldn't necessarily expect a young queer woman to get pregnant in the same way they might expect a straight woman to get pregnant. So that maybe caught me slightly off guard, but it's not been a major challenge, and overall I've been pretty lucky.
That's amazing. Really nice to hear that you had a positive response with that. But you know, how dare we, any queer person, have a normal heteronormative plan of having children and a family? What does that mean? What?
I know, exactly.
So no, that's really interesting actually to hear how you found that, and that it sort of caught people off guard, but overall it really wasn't too negative a reaction.
No, as I say, I think I'm really lucky actually with my workplace, and particularly with the people I've got around me. I know a lot of people's experiences aren't quite so positive, but mine's been pretty universally positive. So yeah, I'm really lucky.
So then, speaking of positivity, could you tell me about any example of a positive reaction or a positive experience you've had with anyone that you've impacted from your visibility and your representation as a visible lesbian in the community? Has anyone ever come back to you and said, oh, you had a positive influence on me, or you're inspiring, or anything like that?
I don't know that anyone's ever been that specific, but I think I have definitely felt it when I've had both students and actually patients as well come up to me and kind of come out or talk about their experiences in a way that I don't think they would with my colleagues. And I'm not always visibly out in terms of, it might not be immediately obvious in my NHS work just because I'm functioning day to day in my job. My colleagues all know, but my patients might not. But I think even having that background means that hopefully I'm kind of more approachable as a doctor, and people feel more comfortable to be honest and open about their own situations. And I've definitely noticed that, yeah, as I say, overall, both with patients and with students, feeling kind of comfortable to talk about those sorts of things.
That's brilliant. No, that's wonderful to hear. Really wonderful. I think we need more positive vibes going out into the lesbian community, and more safe spaces. So you mentioned there sort of health, and in terms of being a doctor, not necessarily asking you as a doctor, but obviously we're aware that queer women, so lesbian, bi, queer women, women who have sex with women, these people aren't necessarily going and getting checked and tested for STIs, and maybe aren't even being pushed to as much as their heterosexual counterparts. I've got research that shows that less than half of lesbian, bi, and queer women are actually going to get tested for STIs, but that more than half of those people who are getting tested are coming back with positive results saying that they do have STIs. So it's so important that it's taken seriously and talked about more, and that they are encouraged to go and get tested because they aren't immune from it. And things like herpes and chlamydia can still be spread between women who are having sex with women. So asking you in general in the community, do you find that lesbian women are talking about sexual health, and this is a topic that comes up?
I probably get it come up a little bit more than your average queer woman, just because of my kind of medical background. So it does come up fairly frequently in my circles, but I think there are still a lot of misconceptions, and probably, you know, doctors have a reasonable amount to answer for there, because actually there's a lot of misconceptions among my professional community as well. So while it's true that some women who have sex with women are at lower risk of certain diseases, they're not at lower risk of everything. And certainly, as you said, I mean, even that statistic surprises me, that half of the tests that come back, or more than half of them, come back positive for something. That's really surprising to me. but yeah, so obviously they are still at risk of a range of different conditions. But even cervical screening, for example, I've heard it so many times that women who aren't having sex with anyone with a penis don't need to get smear tests, which is absolutely not true.
A myth.
Yeah, exactly. So I think so I've heard a lot of different misconceptions like that. I've had friends ask me if those sorts of things are true. And also I think it's fair to say that the options available to women who are having sex with women in terms of protecting themselves are a lot more limited. So we don't have something as simple to use as condoms, for example. Cling film and dental dams don't really seem appealing to the majority of women.
They're not the sexiest.
They're not the sexiest, are they? No.
You got flavored condoms.
A lot of women don't even know that they exist, that that's an option. So yeah, they're certainly not as widely available. So I think kind of a combination of factors mean that, yeah, it's not kind of forefront of everybody's mind.
Definitely. It's a really key issue, to be honest. And it's great to have someone who's an expert here to talk to us about sexual health, having worked in that field. How lucky are we? Amazing. Thank you. So I've got another question about sexual health. As we've got a medical professional here and you work in that field, what kind of things would you say to someone about getting tested as a lesbian, bi or queer woman?
So the first thing to say is it's not as scary as it might seem. If you've not had it done before, it's over really quickly, and now you can get away with mostly doing everything yourself anyway, so you can avoid a lot of the bits that used to be a bit awkward or embarrassing. What I would suggest is getting tested if you've got any kind of suspicion that something might be wrong. So if you've got any symptoms like itching, burning, discharge that you don't think should be there, those sorts of things, or any sores, then definitely that's a prompt to go get tested. And otherwise, it's always just a good idea to go and get tested in between each sexual partner. Or if you've got lots of partners or you're having casual sex, then roughly every 6 months or so.
So that's really important. Thank you very much. We've all got to remember to take our sexual health seriously and get tested regularly. Thank you very much.
Thanks
for answering that question. Cool. So I think largely that kind of concludes most of our questions. It's just really highlighting how important it is to be visible if we can, if it's safe to be, and the positive impact it can have. And I'm sure people watching this will be inspired by you and excited to see the possibility of having their best queer life. And
I don't know about that, but I hope so. I think, yeah.
Or a normal queer life that's just a person living their life.
Why would you live a normal life when you can live your best life?
True. We'll aim for all of the above, the rainbow of expectations.
Yeah, for sure.
Because, yeah, that makes sense. But yeah, no, thank you very much for your time. Get tested, kids. Congratulations for, taking part, and thank you for taking part in our Lesbian Visibility Week video. We hope lots of people watch this and just get to see an amazing visible lesbian and learn some things. Thank you.
Yeah, you're welcome.